Hi, Richmond. It's Pat Lane, and I'm glad to be with you this hour. We're going to have a good show for you tonight. It's entitled Community Awareness, Caring for the Community. And so when we talk about caring for the community, of course, you all know that I'm a nurse, and so I think nurses care for all of the community. So we're going to share our perspective with you tonight about various things in nursing. And I have with us tonight the Central Virginia Black Nurses Association. So we're going to talk a little bit about that as well as our profession. So I'll start off with some introductions, and I'm going to let them say hello and start to get that rolling so you can learn a little bit about each one of their specialties. And I'll start with, like I said, light introductions. Right to my left is Janet Porter, and Janet is a neuroscience nurse. She's the president of the Black Nurses Association in Central Virginia, and she works at VCU. And the next to her is Annie Gooden, and Annie is also a nurse at MCV VCU, and she's a graduate of Hampton University. And I'll let Janet come back and talk a little bit about herself. And she is the vice president of the Central Virginia Black Nurses Association. And then towards the end is Erica Davis, and she is the treasurer of the Central Virginia Black Nurses Association, and she is a nurse at Bon Secours and a graduate of Virginia State University. So as I said, we have our officers tonight of the Central Virginia Black Nurses Association. So let me tell you a little bit about the Black Nurses Association, and then I'll let Janet talk a little bit more about that and introduce herself. The Black Nurses Association was founded in 1971. It does represent 150,000 nurses across the United States with over 70 chapters throughout the United States. And our mission is to make sure that there's education, research, and access to care, and that the voice is heard for all African Americans and actually for all patients and the community. So we are here to serve, and that is our true mission. The Central Virginia chapter is in Richmond, but we reach out to Hopewell and Petersburg, and I'll let Janet talk a little bit about that. Tonight, after the introductions, we all will talk a little bit about why we went into nursing, why it's our calling, and what we hope to do to serve, and to show you some of that service that we do every day in our educational areas, and then to talk to you. We're going to open up the calls tonight around 6:30 to 6:45, and here's my challenge to you, community. We have loyal listeners from 6 to 7 on Wednesdays. And we want to have robust conversations about what you want to hear about in the realm of healthcare. So tonight, you can feel free to call us and ask us questions, and we'll get resources. But we're going to be planning for the future. And we're going to want to know what you want to hear from us to better educate you, to help you prepare better for your health. So Janet, thank you for being here tonight. If you want to elaborate more on your introduction and tell them a little bit about some of the activities of the Richmond chapter, where we're meeting, and that kind of information.
Good evening. My name is Janet Porter. I work at VCU Medical Center. I'm also the president of Central Virginia chapter, Black Nurses. We do a lot of things in the community. February was a busy month for us, so we worked with the American Heart Association, with the Go Red, Get to Goal. We also do community services with Petersburg Wellness Consortium. We're starting that. Last year we were busy with the go vote for voting registration, so we did a lot of things in the community.
And I know we have a meeting coming up, so if somebody wanted to come, and we take not just nurses, we also have nursing students, friends of nursing, anybody who wants to know what is the health and welfare of what's going on in Richmond. we try to help with that as well. So our next meeting is where and when?
Our next meeting is April 16th at Krause Auditorium in Chippenham Hospital. It's from 5:30 to around 7:30 p.m. We meet once a month, and the only break we have is from in July and August. We will have our annual conference, our 41st annual conference. In fact, you can get continuing education while you go to the conference network. It's really nice.
Okay. And Janet, you have served as president. You've also served as vice president as well, correct?
Yes, that's correct.
Okay. And Annie, thank you for being on the show.
Thank you for having me.
And you're the vice president. So tell us a little bit about what you do on a daily basis. And I said where you went. I said Annie went to the Hampton Institute for Nursing. And actually, Janet, you went to, where'd you go to school?
I went to two schools. I went to John Tyler Community College. I got my associate degree, and then I went back to school for the RN to BSN at Old Dominion University.
Okay. So one of the things that you're going to hear throughout, and I didn't talk about my education, but you're going to hear throughout as Erica goes on, is that in healthcare, you continually have education. So I'm going to turn it to Annie because not only does she continue to be in school, but she also teaches that as well. So Annie, tell the audience a little bit about you.
Well, hello everyone, and thank you for having me, Ms. Lane. I am presently employed at the VCU Health System in Women's Health, and as she said, I'm adjunct faculty with Virginia State University, which I enjoy thoroughly with our young students. Being a part of the Black Nurses Association, one of the things that we've done is we have partnered with Virginia State University to work with the students and mentor the students. And we are doing research with that and finding, is that an impact to partner our students with an already RN who is experienced, to encourage them, to let them know that yes, they can make it through nursing school. And also, as they graduate from Virginia State University, our plan is for them to continue their education. After they get their associate's degree, we are recommending that they continue to get their bachelor's degree in nursing. And as I tell all of my students, if you're in your 20s and your 30s, my expectation is that you get a DNP, a Doctor of Nursing Practice, or a PhD. So they're listening to me, and I'm waiting for them to come back with all of that information as they graduate from one school to the next.
So that's a nice segue to poor Erica, who's sitting there. And Erica is really special, and actually one of the examples of actually what Annie just talked about. Erica is a graduate of Virginia State University, and she's actually my mentee. I feel like a daughter if her mother wasn't here from Indiana. But that's exactly what you want. When she was in school, she said, I needed a mentor, and I've been very proud of all her accomplishments. So Erica, tell the audience a little bit about you. You've been out for 2 years now. Yes, I was thinking about that.
I have been a nurse for almost 2 years now. I'm currently working at St. Francis Hospital on a PCC unit, which is mostly telemetry, so working with heart patients, patients with strokes, patients who have heart attacks, congestive heart failure. And I'm currently continuing my education. I go to Old Dominion University, and I'll be done in December getting my BSN.
Okay, so you hear that education, education, education. And one of the things that I really wanted Erica to expand on, and then we'll start talking about our different specialties, was when she was at Virginia State, she also was very active in the nurses student organization. And so what I want to say to all young people out here is to make sure, or those in school, make sure you are a part of a professional organization, especially those aspiring to be in nursing school or in healthcare. We're really looking for persons who help the community, because that's what it's about in healthcare. We really want to make sure that you are able to do that. So we're looking for people that will be able to give service back to the community and to be able to spread that education. So Erica was very instrumental in working in the Nurses Student Association, was an officer there, and then was very interested in the Black Nurses Association and had the opportunity to actually go to a national conference and talk about that experience.
Yes, that the conference was in Indianapolis, Indiana. It was my first conference, and it was so much fun. So I learned a lot. I took in a lot. I gained a lot of knowledge. I gained a lot of what I have to do as a nurse in the beginning. So I encourage a lot of people, if they join the National Black Nurses Associations, to go to these conferences because they help you. They give you a lot of knowledge.
So what was amazing, she said she went and learned a lot. She didn't tell you that she ended up being a facilitator for the summer youth camp. So, and this was not only this was our first summer youth camp that we ever had. Again, we want to make sure, when I talked about our message in healthcare, that we're mentoring everyone to be in the healthcare professional. Because as I age seasonally, I need to make sure there's some good healthcare providers out there to be able to care for me. So Erica was really instrumental. I can't even remember how many we had.
We had 24, was it 24, 27, around that.
So got there like the first day, and I said, Erica, you're going to help me put this on because you want to be able to relate to younger students. And they were in awe of Erica, who had just graduated from college. Went all the way from Indiana to Virginia State University, was able to do that, was able to talk about your boards, because all of us have to take a special test. That's the one thing I want you to know when you start with your nursing career or some of the healthcare fields. Well, let me back up a little bit. If you're interested in any of the healthcare fields, there's some homework that you need to do. And so parents and students, one thing I'm going to say, and I think all of us will say, you can do whatever you would like to do in life. Don't let anybody tell you that you can't, but you must be prepared to be able to do that. So for nursing in particular, or for any, and actually, Janet, you had another path that you might want to talk about with the audience as well. Math and science are very important. So I would tell you, if there's one thing that you want to buckle down on is to be able to get math and science. And then some of the things that we could do as the Black Nurses Association, if you're a student and you're struggling, we may be able to provide tutors for you. So let me give you this website, www.nbna.org. They're having scholarships right now. You have until Monday, April 15th. But there are scholarships that are available to those who are interested in going in the nursing field. You also can look up our chapter, Central Virginia, and get Janet's name and be able to contact her as well. So again, it is a mentorship because, again, in this side, you really need people to help you to be able to get into your career. All right, so I've talked a little bit about nursing, and you know that's my passion, audience. I've been talking about that for a while, and we'll come back to it. But I now want to start to share some of the specialties of each person. I am a neuroscience nurse by background, and so is Janet is a neuroscience nurse. So you know what they say, you just hang out with those types of persons that you really like. Annie is women's health. So I know we have not covered that, and so I'm real excited to be able to cover some of those things. And we may not know all the answers out here, audience, but we certainly will be able to tell you the resources that you want to get. And Erica is in what I wanted her to talk about. She said telemetry. Another thing, audience, please feel free to call. It's 6:30. We use terminology, and we're going to really probably do that all day today, use a lot of jargon. If you don't understand what we're saying, like what in the world is telemetry, please ask. I'm going to ask Erica to talk about what that means if you're on a telemetry unit. What does that do?
Telemetry units usually monitor your heart. We're checking your heart as you stay in the hospital, seeing if anything is going wrong. We hook a machine up, an EKG machine up to you, and we just watch your rhythms, making sure everything is good.
Okay. And so what you need to know also, audience, is cardiovascular disease is the #1 cause of death. And so, again, we want to be proactive. So if you're on a telemetry unit, If you're sick, there's some things that we may want to be looking for, some EKG changes. If you're dehydrated, there may be some things that are changed in reference to your strips, so what your heart is doing as well. If you're having an infection, there may be some things that are having problems. If you have diabetes that we've talked about and your sugar is different, there may be some cardiac changes that we want to look. And so we want to put those safety nets into place. So let's talk about neuroscience. We're going to show you a DVD, and it's about how many minutes?
Probably around 4 minutes.
Okay.
Just knowing the signs of stroke.
Okay, so May is Stroke Awareness Month, and we're going to get you started. And you know I always like to do that. And so we're going to show you a DVD. It's a little quick one, but we hope that this will start the dialogue with you, and then Janet will be able to follow up with that. And I will actually, all of us up here, when you talk about African Americans, it is our leading cause of death, and it doesn't have to be. So we want to bring you this public service announcement on stroke so that you can be prepared. And again, May is National Stroke Awareness Month, and so we want to make sure that you have the tools or can find the resources to be able to help you to do that. So we're going to now cut to the DVD, and I'm sure it's brought to you by the American Heart Association and the Power to End Stroke.
Yes.
So now.
Why do people who wouldn't think of ignoring this warning ignore this warning? Or this one? Or this one? The warning signs of stroke. Overlook them, and you might never get to wear that dress again.
You say you'd give your right arm to be there for your family? Here's your chance to prove it. Have your blood pressure checked and control it to lower your risk of heart attack and stroke.
No. Pain. Oh, is that my heart? My heart. My heart? No. It'll pass. 911. Could call 911. No. Ambulance. Couldn't do that. Sirens. Neighbors rushing over. Embarrassing. Too embarrassing. Maybe I'll feel better later. Oh.
Some people would rather die than call an ambulance. So that's exactly what they do.
These hands hold tight. These hands love. These hands support. These hands create. These hands save lives. To empower your hands to help make a difference, call the American Heart Association at 877-242-4277 for a CPR class near you. These hands are wise.
Today's the day to make a difference.
To help people live free from heart disease and stroke.
That's why all of us with the American Heart Association are working
to keep our hearts beating strong.
And you might be surprised to find out what all we have done.
Together, we taught hospitals how to better handle stroke emergencies.
Funded research to improve treatments like artificial heart valve,
pacemakers, and coronary stents.
Help fight for nutritious lunches in our schools.
Together, we make it easy for you to choose foods that are heart healthy.
And showed millions of Americans how to use CPR to save a life.
The American Heart Association
was there to get smoking out of our restaurants, bars, and airplanes.
And encourages Americans to learn how healthy their heart really is.
So that we can all live longer and fuller lives.
Today's the day to learn more.
Today's the day to get involved.
Today's the day to live healthier.
The American Heart Association.
The American Heart Association.
The American Heart Association.
Join the American Heart Association's fight against heart disease and stroke.
Visit heart.org/get involved.
Research indicates that today's children may not live as long as their parents. That's why the American Heart Association created this new comprehensive health, wellness, and fitness movement, My Heart, My Life, to empower Americans to get healthier. As part of this movement, the American Heart Association is launching innovative programs in communities across the country, focused on eating and cooking healthier meals, getting daily exercise, and learning how to grow nutritious foods. We bring communities together with the common goal of improving health through fun and engaging activities like community kitchens,
My heart, my life, my community.
teaching gardens,
My heart, my life, my garden.
walking paths, and family fitness activities.
My heart, my life, my path.
With over 99% of Americans needing to improve their heart health, we want to encourage all children, adults, and families to get active together.
My heart, my life, my family.
Join the movement, myheartmylife.org.
So we just finished looking at the DVD, and Janet is going to elaborate on that. Again, American Heart, you saw some key components that we've been talking about for the last couple of weeks. On this Saturday, audience, you know, I'm not a native Richmonder. I'm from Washington, D.C., but I know there's a huge activity. Is it on Monument Avenue with the U-Crop Walk? So that's one of the things that you'll see that the Central Virginia Black Nurses Association would be there, either helping give out water or directing folks or working with people to make sure that they reach their goals of the walk. But that's big. So those are the kinds of exercises. And I'm going to turn this over to Janet to talk a little bit about that PSA and then to give you, and that was a public service announcement. So here's a shout out I'm going to give to anybody who's watching who might like this for their churches. This is something that is available to you if you want to go on to the American Heart Association and be able to get that. You can be able to get that for your church. I will also tell you again, May is Stroke Awareness Month. They have a very nice toolkit called Power to End Stroke. And actually, Janet is the mission chair for HA. And Janet, why don't you tell them a little bit about the Power to End Stroke initiative, and then you can talk about stroke and what it is.
We're just talking about the, how to encourage people to prevent, prevention of stroke. Unfortunately, according to the CDC, Americans is 1 out of 19 Americans die each year from a stroke. It's heart disease and stroke are number 1 and number 3 causes of death in blacks. So it's just getting the word out to different organizations, churches, to let them know that, to help the community understand about about this, how serious the stroke is in the African American community and different communities.
So if you went to the American Heart Association webpage, you could see Power to End Stroke. You could see that video or DVD that was there, and you can download it. And all of this is free. One of my favorite activities, I didn't bring it today, I should have done show and tell, and is they have something called Your Family Tree.
Yes, that's...
And that is very, very powerful. You can download it for free. You can sit there with your family to say, what kind of health chronic issues is in my family, and how can I stop that? So it's a nice family tree. I've taken it, yes, I have taken it to my family reunions, and they have been very upset with me talking about that. But I was like, you know what? I want to see you next year. So let's do this family tree together so we can be able to do that. So there are going to be activities all around. And if everybody listens to your minister. So if you can get your minister to talk about the healthy initiatives, that would be very good. I know Janet is also working with some churches and being able to do some other things. So why don't you talk about what some of the risk factors are of stroke, Janet?
The risk factors, it could be hypertension, which is also known as high blood pressure, diabetes, previous stroke, cardiovascular disease, smoking. These are all excessive alcohol consumption, and I don't know if I said smoking, but these are all risk factors.
And I had to say I was really happy with neuroscience, and I'm going to cut to women's health. In that, First Lady Obama, I don't know her in person, First Lady Obama's initiative on childhood obesity is certainly a factor in reference to stroke. And then last week, President Obama came out with a bill, a huge bill for a research grant on neuroscience and talking about the importance of knowing what's going on in the brain. So kudos to neuroscience and being really elevated and getting the money and research to be able to look at things so that we can better care for ourselves, for our future. And so I'm really pleased about that. Callers, it's almost 6:30. The number to call here is 804-915-5202. Here's my challenge to you tonight. Please call us, and I'm gonna I should have given my iPad to Erica because she can see, that's why you need youth on your panel, so that we can write down, what do you want to hear from us in the future as far as health care? I know some of the things that have been thrown out to us, not ready to talk about it tonight, but we'll be glad to have a segment, is on GMOs. Some people have talked about, what does healthcare reform mean? What does that mean? So I want to hear from you so that we can be able to bring panels on to be able to assist us in the community awareness that you need. In the meantime, we're going to cut to Annie, who's going to talk to us about women's health issues a little bit, and she's got a special message to talk to us about what we need to do and doing the right thing. So thanks, Annie, for bringing that to us.
Yes. Well, ladies, you know we are a very special group of people, so we really need to take care of ourselves from head to toe. So just number one, prevention is one of the main things. Prevention and knowing your family history. So as I started the top, always get your eyes checked annually. If your vision is changing, it could be related to diabetes. Come on down your mouth. Go to your dentist twice a year or annually. You can get infections in your gums that can cause heart problems if you don't. So that's very important. You come on down, you do breast self-exams. You should do that monthly. You can also engage your partner in assisting you with that. You can pick a special time of the month, payday, the date of your birth date of the month, to check that. You will be the first one to find the lump, not the doctor. So make sure that you're doing those self-exams once a month. And you come on down. You want to go to your GYN doctor to have your annual GYN checkup to make sure that everything is okay in the vaginal area, in the uterus. So you will want to get your Pap Smear when it's time. Now I have hot off the press the new guidelines for getting a Pap Smear. All ladies who are under 21, you do not need a Pap Smear. And I am stressing that because when you go to your physician for your checkup, he may put in a speculum, he may look at your cervix just to see that everything looks okay. It does not mean that he did a Pap Smear. So when you go to your physician, always ask, what did you do? What tests did you perform today? You have the right to know that information. If it's not told to you, please ask. You have the right to know. And as you continue on down to your feet, if you're older, you want to make sure that your feet are doing fine, because if you have diabetes, you're going to have, problems with your feet or sores and healing. So just from head to toe, think of all of those things and taking care of yourself. So we used to would go to our primary care doctor and you get everything done, but now we have the eye doctor, we have the dentist, we have the primary care, we have the GYN. So we need to do all of those things so that we can take care of ourselves, and in between, if we have problems, make those appointments. Now, the hottest off the press guidelines for Pap smear: if you're under 21, you do not need a Pap smear. If you're between 21 and 29, you need a Pap smear every 3 years. If you are age 30 to 65, you can have a Pap smear and a HPV test. And HPV stands for human papillomavirus. That is the virus that causes us as women to have abnormal Pap smears. So this test is collected the same way that the doctor takes your Pap smear. So when this is done,
hold on to that thought. Hi, caller.
Hello.
How are you?
I'm doing fine. How are you?
I'm good. How can we help you?
Hi. I'm calling because I want to know about, can you talk about in the future about menopause? Because, you know, there's a commercial that they say about menopause. They tell you about the first thing when you're going to go through when you're a teenager, but they don't talk about menopause.
Okay. All right. Thank you.
Thank you.
How old are you?
How old are you, caller?
I'm 49, about to be 50.
Okay. All right.
Okay.
And one of the things, and now Annie's going to get back to that, but here's the other thing. Know your family history for anything, because callers, it can be repetitive. So know your family history. I'm going to let Annie pick up that. That's not my, I'm a head girl.
On menopause, menopause can start early, but the usual time for menopause is usually between the ages of 48 to 52. But it can be longer than that time, and most women, when they're going through menopause, they call it the perimenopausal time, meaning around that time. Now, you're not considered in menopause until you have not had your menstrual cycle for a full year. Meaning if you have your cycles, and normally they're every 28 to 30 days, and all of a sudden it's been 2 months, no menstrual cycle. Then you have a period. 6 months, no menstrual cycle. Then you go back to having a menstrual cycle every month like clockwork. Then all of a sudden it's 4 months, 6 months. That's what your cycle does around menopause time. And during that time also, you will start feeling hot flashes, mood swings, and that all goes with menopause. So if you're having those symptoms, you can see your GYN. He can recommend whether or not you need medication for that. And it can be an individual thing, because some people want hormone replacement, some people don't. Some people want pills, some people want to try the herbal things, and different things work for different people. So you have to try it to see if it works for you. And if that plan works for you, great. If it doesn't work for you, talk to your physician again. This is not working. What can we do different? So you'd have to try it until you get the right fit.
And that was good advice. And I'm going to bring Erica in now to talk about that. Annie did a really nice job of talking about going from your head to toe assessment doing pre-screenings. I want Erica, especially with being I don't want to say the youngest, but the closest to just graduating from school, to really talk about, you know, because it's a scary deal when you come into any type of hospital, especially some of our community members have never been in a hospital, never been sick. And so we want you, again, this is called caring for the community. Nurses care for the community. And one way we can do that with you is to be honest about what you can expect when you walk through those doors, what's going to happen, and what things we need to know to better care for you. So I want Erica just to share some of that perspective.
If you ever have to go to the hospital or to the doctor's office, don't be scared. We're not there to get you in trouble. We just want to know the truth. The truth is very important, because any little thing that you do can affect the treatment that the doctor is trying to treat you with. So just be honest. We're not there to get you in trouble, which a lot of people do get scared from being honest. Also, any just any symptoms you have, let us know. Bring in your prescription list. Everybody should write down their medications. Write down your medications, the doses you take, how many times a day you take it, and bring it with you. You should actually try to carry it with you in your wallet or your purse, because it's important to have your medications.
Excuse me, Erica. Hi, caller. How can I help you?
Hello. Yeah, I was calling because I wanted to know, like, what is the best thing to do when you're having heartburn or either acid reflux?
Okay. All right. Are you trying to figure out what's the difference between heartburn, acid reflux, and maybe a heart attack?
Yeah, I wanted to know the difference and what's the best thing to do to possibly avoid it.
Okay. All right. Thank you. I'm going to let you finish that, and then we can talk about that a little bit.
Okay. And also, when you go to the doctor's office, when you bring the list of medications that the doctor has prescribed with you, let us know which ones you are taking. And if you're having trouble to afford medications, let us know too, because we can help you. If a doctor gives you medication you need to take and you can't afford it, it's good to communicate with the nurses, communicate with your healthcare providers, because we're here to help you, not to just leave you out in the dust. So just being able to.
And there are a lot of people on the team. I mean, you may have a nurse, you may have a tech, you may have radiologists, you may have a therapist, you may have a physician, a resident. It could be very overwhelming. So always ask. I mean, it's your body, it's your right, it's your temple. So you want to make sure you take care of your temple. And the best way we can do that is for you to be honest. And when Erica talk about her medicines, please, if you get nothing else from this, write down your medicines and the things you take and your daily activities. If you looked at any of our shows, it's important for you to keep your journals. What you're eating, what you're doing, your activities. We just had the caller talking about acid reflux. One of the first things that a practitioner is going to say to you is, what did you eat today? What did you drink today? What was your activity? When did you go to sleep? Did you eat and did you go to sleep? Are there other symptoms with that? So, you know, the big thing when we hear indigestion or we hear any of that kind of pain, the first thing we're going to want to make sure, and we do this a lot, we want to rule out something. So we're looking at crisis prevention, ruling out. So we're going to rule out what we call a heart attack. So when Erica was talking about that telemetry, if you're saying I'm having indigestion, I'm having heartburn or what's going on, that's the first thing we may do is hook you up to that EKG machine and get some labs and things from you. But one of the things is you want to look at your eating pattern. The other thing that your practitioner may tell you to do is to go to a nutritionist. They are really good. To go see your nutritionist. Your pharmacist now at CVS and Walgreens, excellent. Excellent for being able to give you information on what things are doing. Was it last week? Week before last, I did a show and it's on YouTube and we did it on neuroscience and nutrition. And we talked about spices and we talked about chemicals and things that happen. One of the things that I'm just thinking when we talk about what we take, well, cinnamon is one that people take all the time. They may take cinnamon pills. You may put a couple of teaspoons of cinnamon in your coffee or your apple or whatever you do, because that helps with your metabolism. When you go in and get that triage, when Erica was talking about that, when that nurse is asking you, what are you taking? Don't forget to tell them you've been on cinnamon. Those little things could mean a lot of things to us as we're putting those puzzle pieces together to be able to do that. We have about 5 more minutes, callers, if you want to talk to us or call in with other ideas that you'd like for us to talk about in the future. I want to talk about education a little bit. You know, I went to school back in the day, and I'm just going to leave it at that, back in the day. So I don't want anybody to care for me like I learned back in the day. So you did hear Erica and Janet talk about how they went to school at ODU. And actually, Erica is in there now. So I wanted her to talk about the program, because not all programs now are as structured as you have to go to school, go to campus or whatever. So I want her to talk about that experience, and then we'll talk about nursing schools because I'm also on the board of nursing. So I just want to talk to you how to shop around and look for a school, what you want to see.
Well, the ODU University program is either on-site, web-based, or video stream. Video stream is where you can actually, it's either be at home and watch it as if you're watching TV and watch your teacher, or go to a classroom and watch your teacher from distant learning. So you don't have to be on the Norfolk campus. You can actually be in Richmond. Web-based is no teacher. You just do everything. They write it out, give you a syllabus, rubric, and you do your work, get it and turn it in. And then on-site is just your traditional classes that you can take. The program, you can do full-time, part-time, one class a semester, two, just whatever fits you. Old Dominion University really tries to work with your schedule. Once a week, Mondays are normally the days that they have classes, and it fits into a busy work schedule.
Mm-hmm. So nurses celebration for Nurses Week is also in May. There's a lot going on in May. Mother's Day, Nurses Week, Florence Nightingale's birthday. So we celebrate that. I think it's May the 6th through or whatever, that first week of May. So if you see a nurse, make sure that you also thank them for all that they do. We, those who are in nursing are really caring and really want to be able to help people, and that's one of the things we want to say. Go right ahead, Jen.
Also want to, we have Nurse Appreciation Night. It's at the Diamond with the Flying Squirrels. In order to show appreciation, the Flying Squirrels are offering the members of Central Virginia chapter, but all nurses can celebrate during Nurse Appreciation Week.
And what night is that?
That's going to be May 8th. General admission is $5, and reserve Diamond Club seat is $10. I don't know if that's a special rate for us, but this is for Nurse Appreciation Night.
So that sounds like a fun night. Yes. If you want to continue the conversation, some of us may come out there and talk to you as well there. I would be really remiss if I did not talk about numbers. Annie talked about ages for tests. We need to talk about numbers as well. So Janet, why don't you start talking about hypertension and what numbers we're looking for, and again, reinforcing that discussion about what you need to hear from your practitioners and what you do.
Okay. It's important to know your numbers and monitor your blood pressure. If you have a blood pressure machine, if you have high blood pressure, you should get monitor your blood pressure with the machine, or you can go to the local Walgreens and you can monitor your blood pressure. But normal blood pressure is 120 over 80. Your pre-hypertension are 120 to 130, 121 to 139. And the bottom number is 80 over 89. And your top numbers are considered systolic, which is just, this is the blood forcing through the vessel. And then your diastolic, which is the bottom number, is the blood that is relaxed through the vessel, blood vessel. And hypertension is 140 over 90. So it's important to monitor your blood pressure, know your numbers.
So the other numbers that I always stress, audience, is your cholesterol, okay? And so I'm just going to throw that out there, and then I'll let Erica and Annie talk about diabetes a little bit, and then we'll move on to the next subject. But you need to know your cholesterol, because cholesterol is also, we're talking about telemetry, cardiovascular. The cholesterol is what builds up that plaque or that like gooey stuff that we don't want in our arteries. If it is built up there, then you can't have that blood flow. And your heart and your brain need that blood flow. So you have two things that I look at for your cholesterol level. Again, remember what Erica said. Talk to your doctor. Tell them everything that you're on and what you're doing, so we know which way to be able to help you better your care. So for your cholesterol, it's LDL, which I call it your lethal cholesterol. So you want it low. Lethal, low LDL. I want it under 100. Your healthy or HDL, I want it healthy, I want it high, I want it greater than 40. So remember those little traits and ask your doctor exactly what it is. Ladies, any one of you want to take on diabetes and what that looks like or what it is?
Well, I'd like to just say diabetes, number one, you want to see a nutritionist and look at changing your diet. Sometimes a diet change can make a difference in being on insulin versus being on a tablet versus being on no medication at all. Exercise with diabetes. If you're going to exercise, it needs to be consistent because the exercise will also bring your blood sugars down. Also with diabetes, you want, if we look at numbers, you want your fasting blood sugar, which is your blood sugar first thing in the morning without having eaten anything after 12 midnight. You want that to be under 100. And any other time, like 2 hours after you've eaten breakfast, lunch, or dinner, you want it to be around 120. No higher than that. We have in the past been used to having numbers that are really high, and we're thinking that that's okay, but it's not. When you see a person that has diabetes, most of the time you're going to say they have diabetes, then that affects their blood pressure, the blood pressure is up, then that affects their kidneys, and then they go into kidney disease. So it's almost like you see that triple threat: diabetes, high blood pressure, kidney disease, renal failure. And the next thing you know, you may be on dialysis. So it's very important. It can be prevented or very well controlled. Knowing your family history to know what your risks are. Taking that information with you to your healthcare provider so that they can start a plan for you. So you're talking about this plan where you need a nutritionist, your healthcare provider, and sometimes maybe someone that can help you with that exercise. And you can keep it simple. Keep it, even if you can't afford to go to some state-of-the-art gym, you can always walk around the block. Walking is excellent.
So we only have like 10 minutes left, and this is Nurses Caring for the Community. I talked about May being Nurses Week, and Neuroscience Week is in there, and it's Stroke Awareness Month. But what I didn't talk about, I really wanted to talk about, because it's so important for us to have more nurses. So I want to get that message out strong and clear. If you are interested in becoming a nurse, and it's never too late to go back to school. No. So I want to stress that point. Any of us would be glad to talk to you about that experience. It was my second degree. I had a biology degree, graduated from Virginia State, so it's kind of funny nursing now there. But you can always go back to school again if you have that passion. Don't let anybody tell you you can't. So I do want to start with Erica and talk about, why did you go into nursing? Because I think that's the first thing you need to look at if you're interested in going into nursing. So what did it for you?
Caring. I like to care for people, make them better. You see a change in somebody, you make a difference in somebody's life every day as a nurse. I would say though, if you are thinking about nursing, you have to have the passion. If you don't have the passion for it, it's very hard, and you have to have that passion to keep you going to finish what you need to do to become a nurse. So it was just the passion for caring for people and making them better.
Talk a little bit about your hours in school, because that's another thing. You're a different type of student.
Yes. During nursing school, once you start, it's not a college life. If you're coming in as a college student, freshman, it's study, study, study. You do have time, but it's time management, a lot of time management. You spend about majority of your time reading and studying for nursing. And then maybe 10% of it will be family, social life, and the other things that the university may provide for you.
Which is one of the reasons why Central Virginia Black Nurses really wanted to have a mentorship program. Because if you're in school and trying to have the college life, and everybody else is at least going to a football game or a basketball game, and they're like, come on, and you're like, I got to study. You got to remember what your light is at the end, and that you're really being there to help for somebody. And that's tough. So it was one of the reasons why we really wanted to have a true mentorship program to be able to say, you know what, you'll get through this and you'll have your time and your passion to really feel that. What about you, Annie? What did it for you? Why'd you go to nursing?
Well, I went into nursing. I always said I had 3 choices of what I wanted to be: a teacher, a secretary, or a nurse. I've been a nurse for 34 years. So when you go way back, those were the 3 main things that they thought a female should be anyway. But my career has allowed me to do everything I wanted to do. A secretary, a teacher, and a nurse. And as a little girl, we would always play nursing and doctors. We would even get little needles off of the briar trees, and that was a needle, giving somebody a stick. But so I grew, as I came into high school, it just became more apparent that I wanted to go to nursing school. I wanted to be a nurse. And nursing is a passion. You have to love it. You have to love people. You have to want to give. And I look at nursing as being a servant, because I get so much more from nursing than I feel that my patients get from me, because each day I feel like I have a relationship with someone, that I've affected someone in a positive way. And I was like, that's why I am a nurse. When all of those different positive changes come through, and someone at the end of the day, you made them change their mind about something negative, and they're doing something positive.
What about you, Jan?
Well, I went to nursing kind of roundabout way. I wanted to be a nurse at first, and then I changed my major to wanted to be a pharmacist. So I came to Richmond as a pre-pharmacy student. But I always went back to nursing. I was very sickly when I was a kid, and there was a nurse that helped me. I was very sick with asthma, and this is my way of giving back. I love what I do. I like the field that I'm in. I like working with students. It's just a way of giving back, and I like what I'm doing. I like to see patients that I saw that was really, really sick, and then they come. It's really nice, warm feeling when they come back to see you and say thank you. It's just really nice.
And I think for me, what did it, my parents both were educators, and I said, I am not going to do that. And I'm going to tell you what, I do probably educate more than what my parents did. Because nursing is just that. In order for you, but I have the caring piece with it. When I look back, my dad was a principal and a coach and all that. So he was doing the same thing. I just took it a step further with the biology, with the health and science. And that's truly what nursing is. It's the art and the science put together. And we do have long hours, but we have gratifying hours. And I think, it's nothing better. I'll say it's totally priceless when you're able to be able to help somebody and to be able to show them the differences. The other thing, I know we're coming down to close, but I wanted to talk about the diversity in nursing as well. You don't have to stay in one place. You can go into various things. Erica's already been a nurse for 2 years and has another job and is building on that. So, Annie, how'd you get into women's health? You've had a variety. So.
I've been in women's health for years, and but I've been in high risk inpatient OB nursing. I've been in the United States Army Reserves for 12 years, which took me to a very diverse population, and all of those skills come back to you wherever you are. And presently I'm working with Virginia State with nursing students, and that's very gratifying and encouraging to the students. Yes, you can do this. And I also do prison health services at times. So you can go in so many different directions. And I'm now interested in doing dialysis nursing. And that's the beauty and the joy of nursing. If you are tired of one area, you can always go to another area. But I love my women's health. I love empowering women and letting them know, come with the questions, ask the questions. No question is stupid. None.
So let me ask you this, and we're going off tangent, but I did a show called Why Black Men Don't Go to the Doctor. I won't get on our brothers too bad. I know the phone will jump off the hook at me. But, you know, they don't go to, what about, do you feel like women go to the doctor, or what do we go and then, like, I have an aunt like, I'll go, and then I don't want to hear it anymore. You know, like, I'll shut down from it.
I'm feeling that women usually come in.
Okay.
Women come in when they get symptoms, they are in the office and they want to be seen yesterday.
Okay.
So I personally feel that the females come in.
Okay.
They get checked. If it's anything related to a partner, then they have to go back to the partner and say, yes, you need to get checked as well.
Okay. I want to talk about one more thing. You talked about the HPV.
Yes.
Can you tell me the age? Because that was controversial. I remember get my daughter when it first came out, and they were like, are you
human papillomavirus, the Gardasil vaccine, age 9 to 26.
Oh, wow.
And they also want the boys to be vaccinated. That's very difficult to get that population to get vaccinated. And I even said today, how do we do that? Because women, the HPV causes us to have the abnormal Pap. Until more and more research is done and men find out, what is this doing to me? They don't have symptoms, so they don't go to the doctor for it. So if it's not hurting them, it's no need as far as they're concerned to be checked. So research is going on, and they're thinking that throat cancer might be linked to HPV. So until research comes out and say, yes, this is a problem, and yes, men, you do need to get this, and also if insurances will pay for it, because it's $200.
I do know that there are some things when you talk about women's health. The bone density test was something else that I think was coming up, and actually insurance companies were paying. But here's the deal again. I think all of us are stressing. Ask. You know, ask your insurance companies, demand it if you feel like you need it. You know, another habit is advocacy. We only have a few more minutes, but I want to talk to those out there who may be interested, again, in going to nursing schools. What do you look for in a nursing school? The Virginia Board of Nursing, if you're looking for in Virginia schools, go to their website. Just Google Virginia Board of Nursing and look for schools and their NCLEX pass rates. One thing is that we all have to take that test, and you want to go to a school where they predominantly pass their test rates, because there's nothing more frustrating when you get out of school, you've gotten your degree, can't pass the test, so you want to be prepared to be able to do that. So that's one thing you want to look for, and then you also want to look for funding. Who can be able to help you support that if you need it? We didn't talk at all about clinicals, but you see Annie's and Scrubs. That will be something that you have to do. So thank you, audience. We really enjoyed talking about nursing today, the Black Nurses Association. Go to the website. Enjoy Stroke Awareness Education Month. And please give a hug to all the nurses you know. And we look forward to talking to you again. Thanks for having us. And thank you, panel, for being on.
Thank you.
All right.